Grappling with a quadruple wave of potentially serious viruses just as millions of Americans wrap up the holidays and head back to work. The Centers for Disease Control says cases of the flu, COVID, RSV, and norovirus, or the stomach flu, began to rise just days before the holidays. Just before the holidays, 40 states are now reporting high or very high levels of illnesses, and those numbers will likely climb even higher as the U.S. heads into peak flu season. Dr. Celine Gounder is here with me in Studio 57. She's a CBS News medical contributor, editor-at-large for public health at KFF Health News. Doctor, do we expect that this surge is because we all gathered and that's sort of typical, or what is fueling the spike of all four?
So we typically see flu cases start to go up in December, peak in February. And this is very much the pattern we're seeing again this year, very much driven by holiday gatherings, people traveling, multi-generational gatherings with little kids around grandparents. So that pattern is not surprising. COVID, we're seeing COVID cases go up a bit later than we saw last year. And so we still don't know exactly what COVID season, quote unquote, is going to be. And then with respect to RSV, that one, we typically see increasing over the winter months. And norovirus is called the winter stomach flu for a reason, because we typically see transmission during the winter months.
Yeah, you and I got that. So hopefully that means we're done. We don't get any of the other three, right? That's how medicine and science works. All right, let's talk about which of the viruses poses the biggest risk. And I want to also ask you about vulnerable groups, although you did mention some.
Yeah, so in terms of what poses the biggest risk, it's really important to understand that COVID is still not equivalent to the flu. It is more deadly, particularly in high-risk persons. So
you need to say that again.
Yeah, because COVID is not the flu.
Everybody just says it's just like the flu. I'm not even going to bother getting my
Your
shot.
risk of hospitalization, especially if you're a higher-risk person, is higher with COVID than with the flu. So if you're somebody who's older, if you're immunocompromised, if you have a lot of underlying medical conditions, particularly obesity and diabetes are big risk factors. And then if you're also at the very young end of the spectrum. So for little kids, starting at the age of 6 months of age, you can start vaccinating. And it's those young infants who have very small airways, underdeveloped immune systems, can also quickly get into trouble with a viral respiratory infection.
And when we get those shots, we're not just protecting ourselves, we're protecting those around us. So when is the best time to get vaccinated?
Well, now, if you have not been vaccinated yet, get vaccinated now, because we're seeing the cases starting to go up now. Just in the last day, I've had a couple colleagues, friends, been diagnosed with influenza. So, we're definitely seeing it here in the community. And while these, one thing I think that's really misunderstood with the vaccines is they don't prevent all infections, but they do prevent you from getting really sick, ending up in the hospital, dying.
And a lot of people think, why am I even getting this if I'm going to get sick anyway? But it's that point that is so important. Do you want to get something that is going to knock you out for so many days? And also, again, we're talking about protecting the whole community.
Right, exactly. And so even if you do get it, it'll be a milder case. You'll be able to get back to school or work more quickly if you've been vaccinated. So that's really the benefit of doing that.
So the last time we were talking about norovirus, you were talking about washing our hands. I've taken that to heart. I've got really dry hands right now. But what else is some really good advice for people who are trying to stay healthy? Look, we can't be in a bubble anymore. We have to go to work. We have to go ride public transit.
Well, if you are sick, you should ideally be staying home from school, from work. If you have to go to school or work, washing your hands, especially if you have norovirus, is really important. Wearing a mask is still an option. They do work if you wear them. And then if you're somebody who's involved in food preparation, you really need to be careful if you're sick. To be washing, ideally not doing food prep, but washing your hands if you are. Not sharing food with other people is another key one. And wiping down your kitchen counters, food prep surfaces, all the things involved in preparing the food.
Okay, Dr. Celine Gounder,